Hi, everybody. Thanks for joining us today. We are here today to talk about the Healthcare Analytics Certificate. And so this is our informational webinar to talk about the program, to answer your questions. And we're just making sure everything is working right now with our volume and our cameras, because I cannot see myself right now. But that's okay. I'm going to keep talking and we will figure it out and make sure that everything is working well. So let me introduce myself. My name is Chelsea Norris, and I am the program coordinator for the Healthcare Analytics Certificate program. And so I help organize the program structurally. I help students through the program. I answer all of the questions. Tonight with us too is Kirsten Mijos, who is sitting over to my right, and she is the Director for Healthcare Education and Training here at Continuing and Professional Education. You won't see her on camera or hear her today, but she's running the technical show, and so I just want to call her out because if I'm looking weirdly to my right, that's where she's sitting, and she's going to be monitoring the chat function and the question and answer function for us today. Also with us tonight is Tom Whitmer, and Tom is the president and CEO of Sage Legion, and he also is an instructor with our program. And so Tom will be giving a very robust introduction of himself in just a little bit, and we'll be talking about healthcare data analytics and the field and helping to answer some of those questions for us tonight. So before we go too far, I do want to let you know that this is your session today. And what that means is that Tom and I are here to answer your questions and to make sure that you get all of the information you need to feel comfortable enrolling in the certificate program and moving forward with that. So please make sure that you're asking questions. This is your time. This is why we're all here. You can use the question and answer function, and again, Kirsten will monitor that, or the chat function, and she'll monitor that as well. And we'll stop and answer questions along the way. There's also a dedicated time at the end of the session for you to ask questions. So let me prepare you a little bit. Next we have, I want to talk a little bit about the agenda so you can help time some of your questions. So first we're going to talk about healthcare data analytics as a field in general. What does that even really mean? So if you're new to this field, this will help you get more of an idea of what we are talking about. And then we're going to do an overview of the certificate. How does the certificate work? What are the classes and the structure? How are classes structured? And then we'll talk about finances and costs. And then again, there's a dedicated section at the end for you to ask questions. I also have a couple of polls throughout the night because we want to learn more about you, and we want it to be more of a back and forth conversation. And so although you're not being able to speak tonight in this session, we want to still hear from you. So the first poll Kirsten's going to launch says, where are you logging in from today? Are you close to us in Sacramento? Are you somewhere in Northern California, the West Coast, United States? Pick the one that is the most narrowed down. Yes, I know Sacramento is in Northern California. So make sure that you're narrowing it down to the one that fits the best for you. All right, and I see people quickly clicking in there. Make sure you get your answer in so that we can account for you today. We have a lot of people, it looks like, who are in Northern California. Even wider group that is in the United States, but not Northern California. So that's great. Folks are actually all over the place. And that's really exciting to us because being an online program, we do our best to reach people across the US and even a couple international folks as well. So thank you for clicking in. Again, we'll have a couple other polls throughout to get some more information. This information also helps us, me and Tom, target what we're telling you. And so those polls are really important for us. So now Tom is going to talk about his experience in the field and a little bit about the philosophy of the instructors in the program as well.
Hi, everyone. Can you hear me okay, Chelsea? And
I can, yeah.
Okay, great. Well, welcome, and actually thank you for inviting me to this session. I really appreciate the opportunity to talk about analytics, UC Davis, the program, and just everything that's going on here. I have been teaching in the program for the last 5 years, and I was involved in the program in the beginning when it got formed to create my particular class, which is the data mining class. And my background is I did start my career in manufacturing and did some Big Six consulting back in the day, but probably in the early 90s, I became a director at a community hospital. It was my first job in healthcare. And I was a director of IT and telecom at that organization. And I've I was there for a pretty long time, just over 5 years, and then, moved into some healthcare specific consulting. And then for 10 years, I was at Kaiser Permanente, where I ran corporate systems as the IT. I had business partners in the corporate area, such as legal and compliance and internal audit, corporate research. And then the other half of my position was ran the shared analytics, shared services environments, which was our data warehouses, big data lakes. And we had something like 5,000 analysts there that I supported. And I had all the tool vendors and the contracting for those vendors. Right now, I am actually running an analytics startup. It's focused on actually healthcare and a variety of other industries to help people collaborate more effectively to do analytics. It's just an awesome time to be in the analytics environment right now. There is a tremendous need. It's complicated. All the brain power that we can get is necessary, and to really help executives and senior leaders and team development, really put the promise of analytics to work for patients and for our organization. So that's the way I deal with my students and talk to my students about what's happening in the industry. If you want to maybe flip to the next slide.
Got it.
I think, I believe we have some later slides on the actual program, but in terms of like the other instructors, we get together periodically to review a couple times a year and how the courses are fitting together, how the student flow is going. And they're really an accomplished and diverse group of people who are part of this program, including the administrative staff. I'll speak for myself primarily here that we have a keen recognition that most of the students in this program are busy professionals already. And that comes with it a certain accommodation where we certainly don't dumb down anything that we're doing, but figuring out how best to convey the information and kind of help people lead and learn from where they are in their own careers. In terms of my cohorts, usually it's a variety of people who may be physicians or CFOs or other executives who have found themselves leading or becoming principal investigators for different things. Also maybe some people that are working to get into healthcare, or people that are programmers or highly technical people. So it's really a really diverse program. And I know that the other instructors and myself, we actually, we do run the classes with, obviously it's an online program, but there's much to learn and generate discussion between the students and what they're doing in their own jobs or where they're attempting to get to, as well as the instructor's experience. So there's some pretty terrific ongoing dialogue that happens throughout the course of these execution of the classes, which really for me is the rich part of the engagement and the learning process. So I'll talk a little bit about healthcare and data analytics. Certainly my experience as a CEO for my analytics company right now, which I've been doing for the past year, is that there's just incredible promise in healthcare for some of the analytics that's being developed. And what I mean by that is healthcare is traditionally a laggard in in the application of change management and transformation. And so I don't think that's changing significantly yet. And there's valid reasons for that related to patient privacy and regulations, both local and federal. But at the same time, certainly in my experience in the last 30 years with healthcare individuals, I mean, we have some of the most educated workforce there is. And so the application of some of these emerging capabilities for both like on-prem systems, cloud vendors, specialized analytic algorithm companies, it's tremendous. And, the reason it really matters is because, as I've worked in healthcare, I think about patients as my own family members and how I want to advocate for them, make sure they get the best care, and that the provider community is armed with the best tools and capabilities they can be. And I think that that's certainly shared by the other instructors. There's an urgency, there's a desire to help our industry transform, and great promise. In terms of career possibilities, and I actually run these numbers a lot because my current job, my platform is an analytics collaboration platform. There is approximately 100,000 openings on LinkedIn right now for a title called data scientist. And not everybody knows or cares what a data scientist actually is, but certainly all the enabling professions that come around data science, analyst, leader, transformation leader, ethics, policy, all these topics, there's many, many more jobs around that title than can really be reflected in the data scientist title. And this program is not really about data science specifically. It's more about, to me, leadership and the application of those capabilities in the healthcare environment. And it's pretty much in every facet in healthcare in terms of how to enable data and information in the organization to enhance patient care experience and the operation experience in an organization at pretty much all levels. That's certainly what I've seen, and in all different types of organizations as well, which is really the exciting part, because there's usually a high diversity of people in my classes from different organizations. Many of them are from insurance companies or hospitals or delivery organizations, but also the public health side of things, laboratories and so forth. So it's a very rich opportunity and value add experience for the individuals and the organizations that they're attempting to work in. So do you want to talk about this a little bit, Chelsea? Or
Sure. Yeah, I'd be happy to. So I wanted to put a slide in there talking about, so why a certificate, and we'll talk also about why UC Davis and why continuing in professional education. And essentially there's a continuum of education that you can get around this topic, right? And so there's everything from just online tutorials, you can get SQL tutorials, SAS tutorials, Excel tutorials, all sorts of videos and things for free online. What you don't get with those types of education is the instructor support. You don't get to ask and answer questions or get questions answered from instructors like Tom and our other instructors. You don't get to interact with other students in the class, and Tom just mentioned how really important that can be, that networking experience and opportunity to talk to folks who might be in different careers or positions and get their experience in healthcare data analytics. There's really little real life application. Those sorts of things also don't really go in depth. And you don't earn anything. So yes, maybe you do a quick tutorial on SQL, but you don't get anything to show for it. You could put that on a resume, sort of, but there's nothing to say, hey, look, I completed this training or this education. On the complete other side would be going and getting a graduate degree in data analytics or for a data scientist or some of those other things. And some of the things with that, of course, is that a lot of them are location bound. So you would have to be in a very specific location at the school to be able to earn a master's degree. They can be very costly. The time is laid out for you. So usually for master's degrees, those take about 2 years, and you can't speed them up. You can't, sometimes you can slow them down, but not always. So it's not very flexible for learners. And a lot of them, like I said, aren't online. What we are able to offer you is right in the middle there with the HCA certificate. So when you have the whole continuum of online tutorials to degree programs, we're right in that niche in the middle. And so what you're getting by earning a certificate is that instructor support. So you can ask questions, you can ask for more information, you can network with the instructor, you can network with your colleagues and your fellow students. You earn an actual certificate. So we literally mail you a certificate in the mail. You can order a transcript from us that will list all of the classes that you took and a certificate that you earned afterwards. And so you get that credential that shows that, yes, you completed this. The schedule is up to you. It's very flexible. It's online. I'll talk more about that in a little bit, but it's designed for a working professional. So most of our students are working full-time, have very busy schedules, and you're able to do that because your graduate degrees tend to be very rigid and full-time big commitments. And again, we are more flexible and not as big of a commitment for that. And so for those reasons, if you're looking for those different things, the HCA certificate is really a great way to go. Tom, was there anything I missed that you might want to put in there?
Well, I just would, highlight what you're talking about in terms of like being in the middle and the flexibility. I would say maybe a very small percentage, usually not more than 20% of the students that I've had are not working professionals already, and so or they've got some other, they're working full time or quite a lot, and so we're doing a analytics is a high intensity topic, and there's a lot of hype in the industry right now. So there's a variety of what I would consider to be confusing messaging, and to help sort through some of that can be an intense experience throughout the course of the certificate program. What is really meant by these different topics, and how does it apply to healthcare? And so as students get to know the teachers and the instructors, there's, certainly it's encouraged, but like I said, it is it's the important, a little bit of the secret sauce, I think, of what makes the program valuable. And I do see, I've been doing this for 5 years, I do see that, most of the students are very, very appreciative of that, because they're trying to also take these techniques and capabilities and things they're learning and apply them directly to the jobs that they have, or trying to figure out, how their organization is relative to some other things, making sense of that. And so that, I would say those are some of the intangible value adds that I see that come up in the execution of the class.
Great. Yes. Thank you for adding that. All right, so this one here, we wanted to share with you where our students going. A lot of this is where our students starting to be honest with you. These are exact titles and employers of many of our students. And so there's a couple different places where we collect this information if students are willing and wanting to share that with us. But wanted to show you some of the titles that our folks are either coming in with or striving for, because as Tom and I have both mentioned, we have folks who are starting and they're already in this sort of field, or they are attempting to break into it. And so you can see that there are many, many titles that our students fall into, and many employers too, across a wide variety there. Anything else to add with that, or we just kind of wanted to show some examples?
I would maybe jump in on this for a second. So
yeah,
it's, when I see a list like that, to me, the sky's the limit right now for, it's not a one size fits all by any stretch of the imagination. And it is, people are in different phases of their life, phases of their career, and there is a tremendous need for these skills right now. you know, I work in analytics a lot of also outside of healthcare. I also attend a lot of conferences. I just got back from the Strata conference in New York, which was last month, and the Gartner conference on analytics this year. And I mean, our industry in analytics is just really exploding. And there are a lot of, I'm going to call them pop-up schools, pop-up programmers. They can teach people how to be data scientists and learn Python and or something like that. And those people are getting jobs very easily. And where I would contrast that a little bit with a program like this is that this is really geared for healthcare professionals and the application of these capabilities in healthcare, and how, you know, and that quite frankly is in and of itself a significant component for there's a lot of topics across the spectrum of classes in the program that are related to, well, you know, this is very unique to healthcare. These are some specific things that we have to deal with in healthcare, and how to figure out how to apply these techniques while living within the family of our regulation, our patient care processes, the delivery of medical services, operations, which is really unique to us. And so, you know, you see a broad list here. I really feel like it has been for some time in terms of like the sky's the limit in terms of, you know, how much energy you want to apply to seeking, you know, any number of positions with some very stellar organizations. And so I think this is kind of a short list here, but you know, I really think there's tremendous opportunity for people that really apply themselves to the work.
Thanks, Tom. I appreciate you adding those pieces in there, and that's absolutely true. So speaking of what your goals are, what you all are looking to want to do, we have another poll here for you. So Kirsten is working to launch that, and it says, what are your goals in pursuing the healthcare analytics certificate? So as we've mentioned, students are really coming to us for several different reasons and with several different backgrounds. Awesome. So I'm seeing a bunch of people click in. Go ahead and enter your responses there. Gosh, so we have folks, we have a lot of people, it looks like, and you can keep it running, but I'm just going to mention some of the results. So we have a lot of people who are currently in healthcare and are looking to get into analytics or use it more often. So maybe that is an area of your position that you're interested in. We also have a good chunk of folks who are currently in healthcare analytics and wanting more formal education or a career promotion. So maybe it's one of those things where you sort of started working in analytics, but you want some more information to be able to do more with it. I've talked to several people in the past. We also have a good chunk of folks who are looking for a career change, and so they want to get into healthcare analytics. And then we have folks with other goals. So this actually perfectly shows what we were talking about before, how our students come from several different areas, and we're able to create this program that really meets all of those needs. So that's really exciting to see. Thank you, Kirsten. So we're going to transition a little bit now, and we're going to talk about the program and the certificate itself and the structure and what you can expect. So first, the certificate is 5 courses. These 5 courses are fully online, and there's a weekly progression with the courses. And so what that means is that you have on Wednesdays, material is released. And when I say material, that means like the box on the right, lecture videos, readings, assignments. So that's released on Wednesday, and you have a full week until the following Tuesday. I would say for most of our classes, actually, Tom's getting me a look because I think you've changed. Yours is on a different daily cycle. But you have a full week to complete all of those tasks. You don't have to log in on a specific day. You don't have to log in at a specific time. You have the whole week to complete those tasks when it's convenient for you. And then the next week, the next set of material is released, and you have a full week to work on that, and that's how you progress through the class. I will say there's a class or two, Tom's is one of them, where there are some group projects. So you would do group projects online, so you would have to coordinate with your fellow classmates to work on a group project. It can all be done digitally. And then at the end, for Tom's class at least, there is a day and time that he schedules where you actually present the material that you have come up with for your group project. But that is the only time you would need to log in at a specific day and time. The rest of it is up to you. So we have people who work night shift, and so they work on it during the day. We have other folks who have a bunch of commitments during the day, and I literally am getting some submissions at like 2 a.m. So it's what works for your schedule. We understand that you are busy. And want to make sure that we are flexible for you. If you were to take one class per quarter, you can do that. It's up to you. I would say most of our students take one class per quarter. And when you do that, you can complete those 5 classes in 15 months or less, as we do have 4 quarters per year. And so that's how you're able to do that. I have some folks who say, well, I want to get done faster. I would like to take 2 courses a quarter. And I would say always start with 1 to see how that goes. I think taking an online class, sometimes people think it will be real easy, real quick, won't take that much time, but it does take time. You need to budget, I usually say 6 to 8 hours a week to do your material and your assignments. And so if you were to double that for 2 classes, that would be a very significant amount of time. Of course, it is up to you. But those are the kinds of things that I can talk with you about and help you figure out what might work best for you in your education. The third box there just talks about what you can expect, like what is a class. So we have recorded lecture videos that you can watch. We also have the transcripts all typed up as well, so you can download those too and read through transcripts if that's better for you, or do both. I have students who do both quite often. We have reading assignments, we have textbooks, or we have course readers for most of our classes. And then we also have discussion sections. And so, not sections, discussion posts that students do. We operate our classes through a platform called Canvas. And so that's where you would be getting your materials for class. And there's discussion assignments where you go in and we'll pose a question for you. And you will type a response, you'll be able to read what your classmates say, and you'll be able to interact and exchange information. And it's one of those great places to learn from each other. Our instructors also jump on the discussion boards too and help answer questions and connect people and do things like that. We have assignments for the classes where, depending on what the class is, of course, you'll have different assignments to work through. And then again, some of the classes have presentations. So that's what you can expect when we talk about what these classes entail. So how do you actually progress through this certificate? Here are 5 classes that are required. You can see those listed under course title. They are all 3 units. These are academic units. You do receive academic units and can get a transcript for these classes. And then on the far right, you'll see when they're offered. So F stands for fall, W is winter, SP is spring, and SU is summer. We operate on a quarter system. If you went to a school that was on semesters, this is pretty different. And I have a lot of folks who get just confused by this because they're not used to it. So fall quarter runs from the end of September to the beginning of December. Winter runs from mid-January to about the end of April or so. And then April, May, nope, to the end of March. So winter is mid-January, end of March. Spring is beginning of April, mid-June, and then summer is beginning of July to mid-September. So that's how we come up with the 4 different quarters, and there you can see when they're offered. They're not all offered every quarter. They go on an every other quarter basis, and so that's something important to think about when you're planning when you would take your courses for the certificate. You will notice our first class is Introduction to Healthcare Analytics, and it is offered in the fall. So that is actually happening right now. That class is in its 3rd week, and it will not be offered again starting in January. It will be offered to start at the beginning of April, and so you'd be able to take it then. If you want to get started with the certificate earlier than that, we do have some options for you. One of those options is to start in our 2nd course, Healthcare Data Acquisition and Management. If you'd like to do this, I would like to talk to you before you just sign up for this course. They do start off and are doing SQL in that course right from the very beginning. So if you have some kind of programming background, it can be very, very helpful, and a background in healthcare, of course. So that is a possibility. We do have students who start in that class every time it's offered. I work very closely with the instructor for that class, and he is aware that there are students who that is their first class, and he is flexible with them. And so that is absolutely an option for you. Let's just chat about it before you do that, okay? And the plan would be that you would then in spring take Introduction to Healthcare Analytics, and you would progress from there. All right, so you can start every quarter. I would just have some precautions for you if you wanted to start with healthcare data acquisition and management first. Okay, I'm taking a quick peek at my notes to make sure that I have not missed anything for you.
Chelsea, we got a question around Intro to Statistics and whether that's recommended or required.
Awesome, thank you. So we'll talk about this in a couple of slides, but I'll throw it out there now as well. So we do want you to have experience, specifically a class, unless you have a lot of experience in statistics. We want you to have an Intro to Statistics course before taking our Applied Healthcare Statistics class. It is required, but it's on your honor. So you're all adults. We trust that if we say you need to have an Intro to Statistics before starting, that you will do that. And if you don't, it could potentially make our classes incredibly hard for you. And so it is a requirement, but I am not gonna ask for a transcript. Okay, did that answer it? Okay, awesome. All right, so let's move on a little bit. And this next slide, can you go ahead and advance for us? List some of the things you can expect in class. And Tom, I was hoping you could talk a bit about these things.
Sure. So I will maybe just tilt this a little bit to my own class, which obviously I'm the most familiar with. But I think this is a good overview of things that you can expect across the classes, including, you know, pointing people to the introduction into healthcare if you're new to healthcare, and you know, there is a percentage of students that are not in healthcare but would like to be. So obviously we have our own vocabulary in healthcare, and so that's a good place to start. But I'll speak about the data mining class specifically. And I think this is relatively consistent across all the instructors actually. People are they're professionals, they're working, they have knowledge about many of these topics, and so you know, in terms of like the philosophy I have with people is like the engagement is as important as everything else. There's a certain foundational aspect to have the vocabulary of whatever the topic is talked about, so people are armed with the ability to even ask good questions if they're not familiar with the topic, and also extending their knowledge. And then I give a ton of reading in my class, which it's not like we pluck out things on quizzes or tests that are in the reading, but I like to do a survey of reading because, you know, people, they see the different opinions about some of these analytic and data mining related topics, how people speak about them, and they're just armed for better preparation afterwards. And then we do some hands-on things. In my class, we try to take it from asking for data and data acquisition, whether that is you're just asking someone for data, or you know, you have a sophisticated data cataloging or data governance process in your organization. And then data observation, looking at some data files, not doing anything with them necessarily, but just observing and learning and becoming familiar with data and its legacy and its lineage and where, you know, where it's going. And then we have a group project in my course, which is, you know, to me, data mining and analytics and healthcare certainly is a team sport. There's not much that happens on an individual basis in healthcare or in analytics, because there's so many varied skill sets required. So working with other people, communicating, dealing with collaboration, and coming up with a result and a deliverable, you know, it's part of real life. And you know, we try to stress that in the program. You know, how is this applicable to real jobs and real things people are dealing with? And then there's a wrap up in my course. So there are lectures and there's reading and things like that. And then there's the interactive activities that really help the currency of these classes, because things are dynamic and things are changing. And even though, like I've been doing my class for 5 years, what we're talking about now in the blogs and the way people are talking about them is not the way they were talking about them 5 years ago. Even though they're very similar questions, things have evolved, and the industry is moving forward and so forth. So, that's the relevance aspect to all these classes that people work on all the time.
All right, great. So we had a couple of questions coming through on the board here, and perfect timing because we had some folks talking about, what do I need to do to prepare and where can I find an introduction to stats class? So let's dive into all of that right now. What do you need? How can you be prepared to succeed in this certificate? So the one very hard, fast requirement that we have, like I said, is prior coursework in statistics. And so that is either a course in statistics, it could be an entry-level course, or several years of work experience in statistics. We have a self-assessment on our website that you can take. It's a series of statistical questions, and if you can get through that easily, then you're good to go. If you struggle answering those questions, I would suggest brushing up on your statistics if it maybe has been a little while since you took a statistics course. So where can you take an introduction to, I'm having a hard time saying statistics today. Where can you take an introduction to statistics course to prepare for this? There are lots of places is the answer. I don't have one specific place that I always recommend to people. I suggest looking around. There are lots of online statistics courses that you can take. Coursera even has a couple of them. I would look at local community colleges that you might have. Some might even have an online version for you. And so I would take a look around and see what you can find for that. There are lots and lots of options. It just needs to be a basic introductory statistics course. The other recommendations that we have are prior experience in healthcare. So this is recommended, it is not required, but it does really help because that's what our whole program is grounded in and based in. If you don't feel like you have much or any experience in healthcare and you want to talk about that, at the end of this slide, you will get my email, my contact information, and the ability to make an appointment with me. And I recommend that you talk with me. Let's just chat about it. And maybe there are some resources, or there are some resources that I can help you with to make sure that you're prepared in that aspect as well. Prior data management experience, familiarity with clinical or claims data, strong analytical skills. Again, this just gives you an idea of what you can expect in the classes. And so having experience with those things is recommended and not required. Experience with SAS as well. SAS is a program that we use in some of our later coursework, and it can be a bit of a tricky program, and we jump right into it. And so we jump right into it in applied statistics, or applied healthcare statistics course, which is the third in the series in the certificate. And so if you don't have any SAS experience, or if you're not one of those people who can just pick up programming languages real fast, we do have a SAS primer course that you can take. It is a course where you move through the work at your own leisure, however works for you. So it is not how our other courses work, where each week you have to move through the series of materials, but you move through the weeks at your own pace. And it's a 7-week course. It costs much less, and it'll prepare you to be able to take that statistics course with the SAS material that we use. There's also some other SAS tutorials out there that you're welcome to check out on your own. But if you don't have any experience with SAS, that is definitely something that we recommend. Again, if you have more questions about that, you can ask Kirsten through the function and she'll let me know. Otherwise, sign up for an appointment with me at the end, or give me a call or email, and I'd be happy to walk you through that process as well. I also just wanted to point out that this is geared towards the post-baccalaureate level. So it is not a requirement that you have an undergraduate degree, but it is geared more towards that graduate level of coursework. So you can understand that our courses, while we are flexible and understand that you all are working, they do take some time to get through the material and assignments, and we do have high expectations of our students to be learning that material. Any additional questions that I should answer right now?
You know, we did get a group of questions. Maybe you can go through and decide which ones you'd like to address now and share with Tom, and which ones you want to wait until the end.
Okay, great. So one question is it necessary to purchase software used in classes, or is access provided by the program? You do not need to purchase any software for the program. We do provide online access to SAS academics and a couple of other things, but you do not need to purchase them. What are the deadlines to sign up and pay tuition? Okay, this is a great one that I think I must have skipped. What are the deadlines to sign up and tuition payments? So the way that the certificate works is that you sign up for one class at a time, or however many you're going to take, as they become available. So right now we're registering for winter quarter, which again starts in January, and spring quarter, which starts in April. And so you can register for those classes, and you pay for the classes as you sign up for them. So you do not sign up for the certificate as a whole. You don't pay for the certificate as a whole. You pay and sign up class by class by class. And that way you get the ultimate flexibility of when you want to take the classes. Maybe you need to take a quarter off, maybe one quarter you don't have as many commitments and you want to take two. It just really gives you that flexibility and that power to make that decision for yourself. And another question here, can I be sent info on stats refresher courses mentioned on your website? So again, if you have more questions about the SAS, or not SAS, excuse me, the stats refresher, at the end, you'll get my email address. Please just send me an email and I'd be happy to give you more information on that.
Can I also just make an announcement for everybody who's on the info session? We are going to post a recording of this in the next day or two. So if you're missing slides, you join late, or you have to cut out early, no worries. We'll go ahead and post that within probably tomorrow or the next day. You'll be able to have access to these slides and can review them at your leisure. For Tom, and yeah, we do. So there's a question about material around Medicaid and Medicare. I would say that there's some conversation, and the question is, would the material include an introduction to Medicaid and Medicare? And I would say that there is good mention of it in the Intro to Healthcare Analytics course. We do cover that as a topic, and then there's also additional reading. If you're looking beyond that, one of the gifts of this program is that you can reach out to your instructor and they can assist you in finding more materials. So if you have a particular question or a need to know how a concept or a principle is applied, that would definitely be within the realm that you could work with your instructor, like Tom, on a question like that.
Sure.
Tom, there's another question here that I feel like you might be able to field, which is, can the course knowledge be used in any country, or is it more specific to healthcare in the United States?
I've had a few international students who've come through the data mining class, and you know, I mean, that to me is what the dialogue that type of thing comes out in the dialogue, like assumptions that are presented, you know, which is a U.S. focused orientation. You know, sometimes there'll be questions related to, well, you know, this is what's happening here, and you know, is that applicable, or you know, how do you do that? In my class, we don't speak a lot about laws and regulations or compliance. We do speak about compliance, but in terms of like specific laws and regulations, and you know, we could just have a dialogue about that. I don't know that the Canvas system was mentioned here, which is the learning management system. Certainly from my standpoint, the way that works, just to talk for 2 seconds about that, is that there's a private email system inside of Canvas. So you can do broadcast emails, the instructors can, or the administrators can, to the students. They can also be individual emails. The students can ask private questions through that email system. And then there's also a blogging function, which, you know, there's public blogs, and then there's dialogues between instructors and the students commenting on each other's posts as well. I try to ask provocative, open-ended questions for people to talk about what's going on in their own industry or in their own organization. In their own organization. And then also, really for me, and I think this is for all the instructors, participation is what's required, not experience on that particular question. And so if you don't have any experience with it and you're indicating as such, and that's fine. And as long as you're participating, that's really what it's all about. And that's where these types of topics tend to be explored more, some more currency. Last piece is the Zoom conferencing, which you're using here, is also embedded in the Canvas system. And in my case, we run three Zoom conferences during the 10 weeks. 2 of them are optional office hours, which you are not required to come to. But if you have questions or you want to interact, sometimes it's a career studies activity where people are trying to talk about their careers and different things. Sometimes it's specifically about the class. And then we have 1 mandatory group project presentations, which we do on Zoom. So each of the classes is a little bit different, but there are ample opportunities to engage in different capabilities for doing that.
Great, thank you, Tom. All right, so let's move along here. I just wanted to point out, we've actually talked about several of these things already, but I just wanted to bring it back to why might this be a good idea to do at UC Davis with continuing and professional education. And so we've brainstormed a bit, and this is what we come up with. So this program is designed by professors, but taught by professionals. And so what that means is that you get a commitment to strong and measurable learning objectives, but it's really firmly grounded in the real world. So we have professionals instructing these classes who work in this field every day, who know what's going on and know where the future is with data analytics. And so they're able to provide those real world experiences and answers that you might be looking for. We're also very competitively priced. So if you were to look at graduate degrees or other certificate programs, you will notice that we are very competitively priced. This is also tailored in quality content. So there's a lot of programs out there that administer or have third parties working with them, like EdTech or 2U, and those are through the school, but they're administered by a third party. Ours is not. So this is UC Davis owned and operated. The instructors, Kirsten and I, and our leadership work very hard to make sure the material is appropriate and updated, and we're the ones doing all of that work, and it is not a third party. So you come directly to us and we're the ones doing that work for you. As we've mentioned several times too, it's a diversity of perspectives you would gain. So our instructors come from very diverse backgrounds, experiences, positions, degrees, and our students, same thing. They're coming from a whole wide diversity of experiences. And so you get to tap into that network of the instructors and the students. It's also not an overview. So this program has a strong theoretical base, but it equally has a heavy focus on technical skills like SQL, Tableau, SAS. And so it's not a simple watered down, I'm just gonna kind of get an idea of healthcare data analytics. It has strong theory and focus on technical skills. So you're gonna come out of this program with both of those. Let's go into finances because we're getting close on time. Next slide, please. Thank you. So here it is. So the certificate registration fee is $125. What that is you are registering for the certificate. And when you do that, you are able to track the courses that are required, track what you've fulfilled. I also do that for you, and I communicate with you of, you finish this is what you need to do now, and I help you get through the entire certificate. Like I said, we also, at this time, print and mail certificates to our folks who have completed as well. This is not something you have to do to start the program. If you're not entirely sold on the program, what I recommend students do is take your first course and decide, and then do the certificate of registration later if you think, you know what, yes, I want to pursue this certificate. You also can do it from the very beginning, and that is great, and you get all those benefits from the beginning, but you do not have to. Courses, so courses are $1,200 each, and like I said, you pay as you go. So as you sign up, you pay for a course. There's also textbooks and readers are additional costs to those classes, but there are no other fees or anything like that. We have a couple of discounts that I'll mention. So if you're a UC alum, doesn't have to be Davis, but a UC alum, you can get a discount, and then also group enrollments. So if there are, I believe it's 3 or more people from your organization who would like to do this, and you sign up and go through as a cohort, then you can have a group enrollment discount. We also have, just for being here today and attending this webinar, you can have $100 off your first class. So for those of you, if you happen to be listening to this recording later on, this really is only for folks who have attended today and logged in. And for those of you, I'll be following up with an email and giving you the code that you would use to be able to get this $100 off your first class. We also have other options. We accept private loans. We do not accept federal aid. So your typical financial federal aid is not something that we are able to accept, but we do accept private loans. We also can work with you on GI bills and job training funds as well. And let's finish up. So the last poll I have for you today is I'm asking you to think about, now that you've heard everything that Tom and I have to say, what is your next step? Are you ready to enroll in the program? Do you need to think a little bit more about it? Or do you have some lingering questions that you need answered first? So go ahead and log in. I see lots of people clicking buttons. You have to maximize your screen to be able to see the poll, I am hearing. So if you can't see the poll, maximize your screen and it should pop up there in a little box and you can select. So we only have a couple of lingering questions. So Kirsten's done a great job answering questions. Some people need time to think about it, totally understandable. This can be a really big commitment and we understand that, and that's fine. Please take the time to think about it. And then we also have a really big group who's ready to start, and that's great. And we're really excited to see that too. And so let me give you some options moving forward here. Next slide, perfect. Actually, so time to ask more questions. So go ahead and type your questions in. Oh yeah, go ahead, sorry. Okay. To the next one.
Okay.
I'm doing too many hand motions and Kirsten's getting confused because I'm too animated. I'm so excited, like people want to ask questions and get started. So if you have more questions, type them into Kirsten and she will let me know. But I want to give you this information too. So healthinfo@ucdavis.edu is an email address that will come directly to me, and I will answer those questions for you. My direct line is also down there, the 530 number. You can come right to my desk through that phone number and I will answer your questions. You can also make an appointment with me for this week. So I have a Calendly account and you can see it on there, calendly.com/crnorris, and it'll pull up my calendar and you can make a 15-minute appointment from this afternoon through Friday. And so if you have questions and you want to talk to me directly and you want to make sure that I am sitting at my desk when you're available, go ahead and sign up for an appointment. I ask when you do that you'll enter your phone number and I will call you. So I'll call you for that appointment and I will get all your questions answered and we'll get you going. So those are your 3 options right now. Do we have anything else coming through that I should answer for the group?
Let's see if there's anything. This one probably would be okay.
So yeah, that's a great question. So somebody is asking, how many days in advance do I need to register for a course? So we're actually pretty lucky in our course that you can register super easily up until the day the course starts. You can register online. It's very easy. You just create a profile, log in, pay for the class, everything online. You don't have to talk to anybody if you don't want to. After that, for most of our classes, we allow students to enroll within the first week, as long as they understand that they will need to catch up on the material. And again, you can do that. For some of the classes, you can do it online. If not, if you just call student services, they will enroll you in the class throughout that first week. After that, typically we don't allow students to enroll, but sometimes we do. And so you can always check with me if that's something that has come up. Must the program be completed within a certain amount of time? Yes. So you have 5 years to complete the certificate. So from the first class that you take, you have 5 years to complete the certificate. And that's just because we want to make sure it's not dragging out too far, because information does change. And if you're saying that you're earning a certificate, we want to make sure that you're having that current material. And so you have the 5 years to complete it. I would say our students really are doing it within a year, the 15 months to 2 years. I don't really see people really past that unless something is going on and they need to take a significant amount of time off. Otherwise, people are finishing it in 15 months to 2 years. All right, so I think we're just about up in time. And so we're gonna wrap up. Again, take my information down. You can ask me more questions. I'm here to answer your questions. I wanna take a minute and thank Tom. We really appreciate you logging in today and providing more information. This has been really wonderful, and I think just a great thing for students to hear directly from one of our instructors. So thank you very much for your time today.
Glad to be here. Thank you.
And thank all of you too for logging in. We know your time is valuable as well. And so we really appreciate you being here to hear from us tonight and interacting. And thanks to Kirsten for all of her typing and answering questions on the chat function and running the show for us again. And so I will follow up with emails next week or later this week with you with follow-up information. But for now, we are done. So thank you very much. Have a great rest of your day. Bye-bye.